Welcome, my name is Bobby May, and today I'll be presenting to you the work I did as a graduate student for Utah State University's Master of Public Health, Health Education and Promotion program. I am grateful to Dr. Dasgupta for her mentoring throughout the course of this project. Today I'd like to look with you through the lens of the theory of planned behavior to share what we have learned about the effectiveness of two suicide prevention gatekeeper training programs that are in use in rural Madison County, Idaho. Among youth and young adults in the United States, suicide is consistently gaining prominence as a leading cause of death. It is currently the second leading cause of death for young people ages 15 to 24 across the United States. Between 2007 and 2018, the suicide rate for the 10 to 24-year-old demographic increased by 57.4%. The current suicide rate for Idahoans aged 15 to 24 is 32.5 per 100,000, which is significantly higher than the national average of 14.5 per 100,000. Gatekeeper training programs are one of the evidence-based methods of suicide prevention. These programs help individuals learn to recognize and respond to the signs of suicide. In Madison County, Idaho, there are two gatekeeper programs available: Youth Mental Health First Aid and Question, Persuade, Refer. Youth Mental Health First Aid is an 8-hour course intended for adults who interact on a regular basis with youth ages 12 to 18. It looks broadly at mental health challenges faced by adolescents and equips trainees with the ALGE framework as a tool to respond to a mental health crisis. Participants also practice asking whether someone is planning on committing suicide, and if so, whether they have a plan. Question, Persuade, Refer, or QPR, is a 1 to 2 hour course designed for any adult who wants to recognize and prevent suicide. The mission of QPR is to reduce suicidal behaviors and save lives by providing innovative, practical, and proven suicide prevention training. In Madison County, Idaho, Youth Mental Health First Aid is provided for free to anyone by the local school district. Similarly, QPR is provided for free to any individual or group by trained professors at the local university. The theory of planned behavior is a tool that has been repeatedly used to predict and explain health behaviors. You can see here the constructs that are used to accomplish this. The target behavior we were assessing was the participants' engagement in the suicide prevention skills they had learned in the course. Through the use of focus groups on Zoom and a Qualtrics questionnaire, we sought to understand these 5 main questions as outlined by the theory of planned behavior. Our results and discussion sections are broken down based on the theory of planned behavior constructs. Attitudes toward participating in both of the courses were largely instrumental, meaning that the participants felt they could be useful in preparing them for unforeseen events and would be of value to themselves and others. Thus, participation in gatekeeper training courses is more likely when participants have a general understanding of the prevalence of suicide and the positive impact they can have on saving the life of a loved one. Similarly, participants in both courses felt a high sense of social support. There is some evidence that participants felt less social support from older individuals, such as parents or grandparents, but that as exposure and education about suicide prevention increased, social support also increased. Thus, individuals' confidence to act will grow as more community members are trained. Perceived behavioral control is where the two courses started to diverge. Youth Mental Health First Aid course participants had a much higher perceived control on the skills that they had practiced throughout the training, but manifest a lack of confidence in remembering the ALGE acronym. QPR participants, on the other hand, easily remembered Question, Persuade, Refer, but felt less confidence implementing these concepts. Thus, applied learning creates the greatest sense of behavioral control among participants. Both Youth Mental Health First Aid and QPR participants hoped that they would be prepared and willing to act given signs of suicide. Youth Mental Health First Aid participants expressed a high intent to act, as well as a high intention to recertify in 3 years when the course expires. The intentions of QPR participants were less straightforward. Participants mentioned many circumstances with a lack of consensus about whether or not they would feel confident to act in the given scenario. Many QPR participants expressed a desire for more practice and discussion opportunities. Thus, practice scenarios and discussions about past and potential experiences will strengthen participants' intentions to engage in suicide prevention. Finally, all Youth Mental Health First Aid participants reported using portions of the ALGE framework at some point since they had been trained. The skills that came up the most frequently in our conversations were the ones that had been practiced during the course. QPR participants were more likely to talk about the use of QPR framework on themselves, and it took more prompting to help them see how the principles could apply more broadly to daily life scenarios. Thus, gatekeeper training programs will be more relevant when the course establishes how the skills can be practiced in everyday life. Based on these results, we have 3 recommendations. The first 2 are related. In both Youth Mental Health First Aid and QPR trainings, emphasize practice and discussion throughout the course, with specific scenarios for each of the modules. Give participants an opportunity to develop their own practice scenarios based on experiences or questions they may have. Our last suggestion is in areas where QPR and Youth Mental Health First Aid courses are both available. Strategically use the more streamlined QPR courses to increase a base awareness of suicide. Then recruit QPR participants who are interested in learning and practicing more to participate in the more intensive Youth Mental Health First Aid courses. I'm grateful for the people I have met who are proactively taking measures to become certified, as well as for the people who have helped me in this project.